We're joined by a very special guest. We have with us Mr. Animesh Shukla, Product Line Leader, Impact by Honeywell, a new offering by Honeywell, Honeywell International Private Limited, and he'll be giving a technology presentation. We welcome Animesh. Before you start the presentation, let me also take this opportunity to thank our partners for this second edition of APAC HealthTech Innovation Conclave. We are thankful to Department of Science and Technology, Government of India, Digital India, Technology Development Board and HACC, and also associate partner Impact by Honeywell. So over to you, Animesh, for your technology presentation.
Thank you, Shavik. So I would like to thank the guest of honors and the key speakers for sharing their experience, fact, the use cases around the technology, healthcare segment, right? So it was a very fruitful session for all of us. And we talked about the digital maturity, we talked about the digitization of resources, the workforce, which are the base foundation of any healthcare system, right? We also talked about not just using the dashboard, we also talked about the analytics, the data which we can get from the dashboard. We also talked about the scalable solutions. So I must say that Honeywell as a company, we are focused on healthcare verticals and we are completely aligned with all those points. So I'm going to take you through my presentation, which is basically on the delivery side of healthcare. So before going to my presentation, I would like to give you a brief about Honeywell as a company. So Honeywell is a US MNC. We are among 100 Fortune companies and our headquarters is in Charlotte. So we have four focus verticals all across, and we have good presence in aerospace. We have building technologies, we have performance material technologies, and safety and productivity solutions. So Honeywell as a company is focused on healthcare, and also we are focused on Indian market, need of Indian market. So rightly mentioning today's presentation that Indian healthcare need is completely different, and we need solutions, we need technology which can empower our caregivers. Which can we can improve the existing systems and make some advancement in deliveries. So I'm going to take you through the solution which Honeywell has. We have the IoT. We all are talking about IoT, ML, AI. So Honeywell has developed this solution for hospital, which is based on IoT and AI. This is an indoor positioning system. We call it Safe Steps. So this solution we have built specifically for hospitals in India. We spoke to multiple hospitals all across. We try to understand their operations, how their staff, caregivers, and the uh, ground staff who are there to transport patient one point to another, how they work. So when we talk about technology, we always talk about big investments, big huge machineries and technologies, but we also should take care then who are going to use it. So in our scenario, we should enable the patient who is coming to the hospital, the caregiver, the nurses, the lab assistant, and also even the GDA, general duty assistants, which are there on ground all the time to help patient. So we should enable them with health technology so that we can make best use of their caliber. We can improve their productivity on ground so that they can more focus on delivering good services to patient, right? So end of the day, what we want, good experience to patient, and we also want caregivers focus and attention towards all the patients who are coming for treatment uh, to hospitals or any institution. So we have developed this solution which works on a simple function, which is real-time locationing. So real-time location is the way. So we talked about IT infra. So IT infra, we are utilizing the existing IT infra of any hospital. So we are communicating with zones. We are going to set up zones on each floor of hospital for indoor positioning system, and these zones will communicate with the existing Wi-Fi of any hospital. So we are building a solution which is working in the existing hospital infrastructure, which is communicating with hospital information system. We have NIC today. They have presented their hospital information system capabilities. We are growing day by day. So our system is also capable of getting integrated with those HIS systems, HMS systems, which are already there in the hospitals. So what we do, we simply collect the information. We talked about a lot of data collection and everything. Then also one most important point, we should use the data at right time, right? So right data at right time gives us the information, and this information we can use it to convert analytics, which give us detailed point to point information, how we can improve things, how we can improve productivity, how we can improve delivery of services, right? So Honeywell is using this technology, Honeywell own technology, where we have tags. So we give tags to patient, the staff members, and also these tags can be put on uh, assets. So we are talking about a scalable solution. You can scale up to all the assets which you have in your hospital premises, and we can have the live location. So we call it geofencing. So we have each and every record of each and every person, or the staff members who are there on ground, and how we are using this. So we are converting into useful information in real time. It's not like that we are doing the data analysis at the back, and then we are going to present it to management, not like that. So whatever we are doing in real time. We are converting this information to useful analytics, and we are sending it across all the stakeholders so that they can get benefited. So the first solution which I talked about is geofencing solution. The application is real-time locationing of assets. Assets is patient and staff and medical devices. So I will give you more brief about geofencing solution. So what is geofencing? So this is a dashboard, right? So where you have all the patient and the GDA, general duty assistant, or you can call it porter, or nurses, and the lab assistant. So you have a complete data on a single dashboard. And as if you are if you are taking care of any IPD ward, or if you're taking care of any MRI lab, so you'll be having a dedicated dashboard which will flow all the related information. Suppose I'm a lab assistant, I would like to know how many appointments I have, and what is the status of patient which are coming, so whether they are coming on time or not. If IPD patient is not coming on time for any IPD test, then I will have a clear visibility on their dashboard where exactly this patient is, whether they have left the IPD ward, whether they have arrived outside the lab, or whether they are waiting from last 5 or 10 minutes. Every information will be available to that lab assistant. Also, suppose what we are doing, we are allocating tasks to GDAs. So to bring patient from IPD ward to respective lab to perform this test, but there are lack of accountability because everything is manual as of now. So we are allocating tasks to GDS, but we don't have any track whether they have started the task on time, whether they have arrived at IPD ward at time. So we also don't know whether what was the time taken by this GDA to bring this patient from IPD ward A to the respective location, lab B. So suppose the standard time is just 10 minutes. He's taking 15 minutes and 30 minutes. So that brings a bad experience and also low productivity for that GDA. So what we are doing, we are making those persons accountable. We are assigning tasks. We are doing the auto assignment of tasks. So in a short, we are automating the complete process from picking up the patient, allocating a test. Also, when patient is going to lab, the tests are getting performed. So if you see the map of, so we will upload digital maps of in premises where we will show the live location of patient, live location of GDA. Also we will tell them what task has been assigned to this GDA, whether they have completed the task or not. So I'm just giving you a graphical example. Suppose a patient is entering into hospital, so he will be given a task. So it can be IPD patient or OPD patient. So by this, he will be tracked all across the hospital premises, right, in real time. Also, he will be given an option to scan a QR code. Suppose he wants to find a way, so he will be immediately, as per his UHID, we will give him notification that your appointment is with Mr. Doctor ABC. You can just click on this link, and you will be redirected to Doctor ABC's cabin. So you don't have to. This patient don't have to ask the staff members on ground staff or the security guard or the reception person that where I should go, how should I reach there. So everything will be automated. He can use his smartphones and reach out to that location. After reaching out to this location, he will be getting notification that his waiting time is 30 minutes, and he will be given an option that if your waiting area is full, you can go and sit in next waiting area which is in next block. And as his the appointment of this patient will come, he will get a prior notification that he is next in queue, please be available in the waiting area. So all this notification is helping patient to improve their experience in hospital. You don't have to go and ask every time the nurse or the lab or the assistant, doctor assistant, that when his number will come or how much he has to wait. So everything will be automated, right? Also, if you talk about IPD patient support, IPD patient has scheduled at appointment at MRI lab at morning 8 o'clock. So our system will make sure that GDA who will get an task, auto assigned task at 7:30, so that he will reach to respective IPD ward on time, pick this patient on time, and drop this patient on time outside MRI lab. As soon as this patient is outside MRI lab, lab assistant will get a notification that this patient has arrived, right? So we talked about geofence. We also talked about the mother and child tracking. So this is also a tracking, but this is giving workflows which are used for improving productivity and efficiency of staff members. So we are just keeping all the stakeholders accountable, say it nurse, GDA, or your lab assistant. We are making sure that all the scheduled appointments are getting completed on time, so that the OPD patient, suppose IPD patient has the time slot morning 8 o'clock to 10 o'clock, so that if there's no delay, the after 10 o'clock time should be dedicated for MRI labs, or any blood sample lab. So that 10 after 10 o'clock time should be reserved for OPD patient, so that once they come to respective for tests or respective labs, they should not wait unnecessary, right? Also, we are making sure that our staff, our caregivers, nurses, they do not waste their time in terms of doing unwanted coordination, where's the GDA, where's the patient. So they do not get indulged in that. So they should focus on their primary job, which is taking care of patient, right? So this solution will enable them. So same dashboard will come to nurse, where she can see the complete flow of a patient of their respective IPD ward, the GDA, and everything will be auto assigned to respective GDAs to pick and drop the patient. So what we are doing, we are tracking, we are analyzing, and we are optimizing. So this by this we are seeing how we can improve the productivity of our solution. So now coming to second solution, which is workflow solution. So we are tracking the patient IPD ward, what time he has left the IPD ward, what time he has arrived at lab, how much, what time he waited outside. If any of this waiting time is going beyond a specified time, then there will be notification to respective operations team or the admin team, so that they can take care of such delays and inform the respective authorities that this patient is waiting. This should not happen, this should not be repeated, and by a weekly and monthly we will have a complete report on this. Same way we can track the movement of GDAs. So in a hospital, in a 500 bedded hospital, easily you will find at least 250 200 GDAs who are working on ground, right? So it is very very critical to track the productivity of these GDAs or porter, right? Because they are the transporter, they are involved in day-to-day activities, and if you have a clear visibility of their location, their task, then it will be very very easy to assign any task to them or get the productivity. So suppose a GDA, you will see how many tasks he is doing in a day, whether they are completely involved in an activity or they are idle. So our system is smart enough. So we talked about intelligent system, intelligent data. So our system is smart enough to understand whether a GD is involved in a task or he is free. Accordingly, our system will assign a new task to GDA. So, as a Honeywell, our focus is made in India, and we are making for India. So, this solution saves steps we had developed, we had designed in India for Indian hospital. Also, we are going to manufacture. We are starting the manufacturing of mobility devices in India starting this September. So these devices will be available in Indian market, and we are manufacturing these devices here in our Honeywell Pune factory. So these devices are used for positive patient identification and the asset tracking, and also for your lab uh, QR code and barcode reading. So I will end my session here, and I will be available on this email ID animesh.shukla@honeywell.com for any questions you have for me. And thank you very much for your time.
Thank you so much, Animesh, for an exciting presentation. I must say this SafeScape, if I'm not wrong, can be a game changer because this, I think, is a technology enabling solution, enabling hospitals, improving IPD and OPD patient experience, and it's completely IoT and AI based, as you said, and how it can make a difference in the geo fencing space and also um, for workforce solutions as well. And you also talked about the Made in India, for India products and solution, which Honeywell will be offering soon, especially keeping in mind the mobile devices and all those things. Maybe September, October, we can see all those coming. Thank you so much, Animesh, for joining us. That was Animesh Shukla, product line leader, Impact by Honeywell from Honeywell International Limited. We all know Honeywell is one of the leaders in the various segments, as mentioned by Animesh as well. Thank you so much.